New numbers reveal more than 60% of the state's COVID-19 deaths happened at long-term care facilities. There is a significant increase from the state's previous claims that nursing home deaths were half of the state's total. Call 6 Investigates' Kara Kenny has been tracking the numbers for months now and joins us with today's developments.
New numbers released this week show 1,600 nursing home residents have died from COVID-19, making up 60% of the state's total, a significant uptick. But it's not that nursing home residents are in more danger. It's how the state is collecting and reporting the information. Here's what changed. On July 1st, the state agreed to release nursing home deaths and cases broken down by specific nursing home after pressure from Call 6 Investigates and AARP Indiana. As a result, nursing homes were required to submit their COVID-19 data from March 1st through July 14th. That information is now posted on the state's website.
But now that we're stepping back and taking a comprehensive look at it, the situation is worse than what we thought it was. And so I definitely think that there is something that we can learn. And it just shows how important transparency is through all of this.
The new nursing home death data goes back to March 1st rather than April 8th as the state previously required.
We're pleased that we're finally seeing these numbers, but this is exactly the reason why we were asking for them, because we weren't getting a complete picture of what was going on.
AARP Indiana says the disparities show the importance of good data gathering and reporting.
The difference in the new numbers from what had been previously reported, it just shows how important it is to make this information publicly available. Families need to know it, communities need to know it, and we need to know it as a system to better deploy the resources for the residents and for the staff.
This afternoon, the state reminded everyone the new numbers are preliminary and may still change.
I do want to emphatically put to rest a concern that's been voiced by some. We have never underreported or hid data. Right? We have always reported the aggregate data facilities submitted to us. However, the way we collected data from facilities has changed.
As of this week, 95% of long-term care facilities have reported their historical data to the State Department of Health, and they're working to gather an additional 5%. Kara Kenny, RTV 6.
AARP recommends asking the following questions of your loved one's nursing home. Has anyone tested positive for COVID-19? What is the facility doing to prevent infections? Is the nursing home at full staff? Does the facility have the PPE it needs? And lastly, what are you doing to help residents stay connected to loved ones?